Sure. My name is Pup Beacon, and I live in Long Beach, just outside of Los Angeles. Originally from Northern California, but I've been living down here for about 10 years now.
Okay.
Yeah.
So I came to see quite a few of your posts on Facebook.
Okay.
Because you were quite open about being on PrEP.
Mm-hmm.
What's how long have you been on PrEP?
I've been on PrEP for 2.5 years this month.
Okay.
Mm-hmm.
How have you found it?
It's been absolutely amazing. There's a lot of fear behind HIV and about having an intimate interaction and encounter with another individual or individuals.
Mm-hmm.
And being on PrEP has all but eliminated that fear, at least for me. I know for others, the fear persists, and there's others that there's no fear whatsoever. For me, I'm aware that it's not 100% perfect, but it's pretty darn close. Mm-hmm. So it's been an amazing experience. It's been very liberating for me, mm-hmm. and I've been able to be free during sex and actually be in the moment. Mm-hmm. When you're constantly in fear of HIV, and if you're thinking that whoever you're playing with, that you could get HIV from them, mm-hmm. they become an adversary in a way. They mm-hmm. become, the bad guy in a sexual encounter, mm-hmm. which you really don't want to have that kind of negative emotion and negative headspace when you're having sex with someone. Mm. But if you don't look at them that way and you look and you think that you're protected because of PrEP, that you don't, all those feelings and emotions and that headspace goes away, and you're able to just be in the moment, be present, and enjoy the interaction that you're having at that moment.
And it's interesting the wording that you use, because mm-hmm. within S&M we talk about consent, right?
Right.
So that the idea is that if you've negotiated out a scene, then you can throw yourself into the scene mm-hmm. and really, really enjoy it.
Yeah.
Right? And I see that there's a parallel there with PrEP, because you've already negotiated the safety because you're in control.
Right.
And so you've found that it's been sort of sexually liberating to be able to take that one big elephant in the room and to say, well, we don't have to worry about that
right.
particular one.
At least, when it comes to myself, when it comes to, if there's two partners in a particular physical situation, I being one of them, I know that I'm protected. I know that I'm set. I know that I'm solid. The other individual that I'm playing with, ideally I would have had some form of a conversation about, what their status is, how often do they get checked, and so on and so forth. There are, of course, times that you don't have that conversation, but especially in those times when you don't have that conversation, I already know that I'm protected, so I feel good about that encounter. I feel much more comfortable, much more at ease, and I can enjoy what's going on, because I've already had that negotiation with myself.
Yep. And so, within Australia, I've also been on PrEP for probably about 2.5 years.
Okay.
I prescribe PrEP for people as well, but I've also been able to experience that shift of where I don't feel stressed around HIV. Mm-hmm. And a lot of people will go on to PrEP because of extreme fear of HIV, despite the fact that they may not have particular risk factors. But for me, I think anything that's going to help people feel comfortable with sex is always going to be a good thing.
Yeah, I think especially as gay men, we bring enough baggage into the bedroom. If we're able to eliminate that particularly large piece of luggage, mm-hmm. then it's going to do wonders for us.
So how did PrEP show up on your radar?
Sure. So it primarily showed up on my radar based on, I was, before 2.5 years ago, before I started, I was in close relationships with a couple of different men that told me that they were positive. And I wanted to continue having close relationships with those individuals. And I wanted to figure out, how can I make sure that I'm comfortable and make sure that I'm protected. Before I started on PrEP, I was as unaware about HIV and transmission as anyone gets. Before I started on PrEP, I wouldn't even have sex with someone who had sex with someone that was positive. So if I wanted to have sex with person A and they had sex with person B who was positive, even if they were undetectable, I still wanted to have sex with person A. So that was back then. I've come a long way, but that was my starting point. And so when those two individuals told me that they were positive, that really threw me for a loop, and I really needed to get educated and become an adult and actually know how to take care of myself and take care of my body and frankly take care of those partners as well. And so through those discussions I learned about PrEP, and it just seems like an amazing tool to be able to protect myself against HIV, and not only protect myself but the individuals that I wanted to play with that were positive, they felt better about playing with me because they knew that I was protected, they knew that I was safe, and so they didn't have to worry about transmitting anything on their own. So,
and there is a group of people living with HIV that will not have sex with people who are negative, and I think I can understand why that there's a lot of stigma around HIV.
Sure.
And my hope is that PrEP will change and has changed that.
Well, I think that not only PrEP, but more education and more awareness about thorough treatment for individuals that have HIV. It was the partner study that came out a couple of years ago that showed that for couples that one partner was positive and the other partner was negative, the positive partner didn't transmit HIV to the negative partner. And if I recall right, the individuals in that study tried, any numerous combinations of topping, bottom, with condom, without a condom, and still they didn't transmit just because the HIV medication these days is so good that you're not going to get HIV from someone who's undetectable. Even still, there are still individuals that are, they take a lot of responsibility for their own health, and they don't want to affect someone else's health based on their current situation. So yeah.
Well, and another aspect that the partners study did also highlight was that people will have sex with multiple people.
Right.
So there were seroconversions within the partners study, but when they looked at the virus, it was a different virus from their partners. Right. Which just goes to show that we are sexual beings, and that we can control our own status with something like PrEP.
Yeah, absolutely.
Was it an easy process? What's it like to get on PrEP here in the States?
Sure. So I got on PrEP through two different methods. First, initially when I got on PrEP, it was through a study on PrEP. It was a behavioral study specifically looking at young black men who had sex with other men, so MSM. So that particular study was funded by UCLA, local university, et cetera, their health program. So I was able to get the medication through that study. It was, you come in every couple months, get tested, answer a number of questions about your sexual habits, so on and so forth. So that's one particular route to get on PrEP if you wanted to, just through one of those studies. After that year study was over, I went to my primary care physician at the time with Kaiser, and I was able to get on PrEP pretty quickly, partially because I was already on PrEP. And so when I talked to my doctor, it was just a conversation of, this is the medication I'm already taking, I just want to continue taking it. And so it wasn't that difficult of a conversation. In addition to that, my leather family at the time, my dom had the same physician that I had. And so he already had the PrEP conversation with his physician. So by the time that I came around and met the same physician, it was no problem at all getting on PrEP. And specifically Kaiser in LA has a really strong PrEP program. They have individual physicians that all they handle is PrEP. So, there are different healthcare networks that are more aware about PrEP. There are certainly some that are less aware. Every day I see on Facebook or somewhere else that some physician didn't want to write a prescription for PrEP just because they didn't know about it. And frankly, in my personal humble opinion, they were too lazy to find out about it, and they weren't really caring about that individual's health, just because they didn't want to look into the information. So.
And is it West Hollywood that was saying that they were going to fund PrEP for whoever wanted to go on it?
That I don't know off the top of my head. I do know that there are a number of cities, Seattle, for example. If you want to get on PrEP in Seattle, you're good to go. There's no hassle, there's no barriers, you can get on PrEP. Mm-hmm. So there are certain cities like that are becoming more aware about PrEP on a government level, which is great. So I know that LA does have a strong awareness about PrEP and they are pushing it, but there's also opposition from a certain health organization in LA that will go unnamed for the purpose of that I don't want them coming after me.
And that was the next point that I was going to talk about, that LA does also have a fairly strong anti-PrEP lobby group.
Yes.
So what's it like for gay men in LA in a city that has two opposing viewpoints on PrEP?
Well, I think that, frankly, for the group that does strongly lobby anti-PrEP, they have a lot of money, they have a lot of pull, they've been doing the ye who shall not be named. They have been doing a lot of work in the community for decades.
Mm-hmm.
So they've been around for a long time, and they have a lot of pull, they have a lot of sway, and so it does take a lot of work to fight such a large force. Thankfully, there are a lot of grassroots, other smaller healthcare organizations, the Gay and Lesbian Center, both in LA, and I also believe the center in Long Beach advocates for PrEP, and I know for sure that the folks in LA do. Not only advocate for PrEP, but if you want to get on PrEP, you can go to the center and they'll take care of you. Yeah. So there is definitely, as you said, those two voices when it comes to PrEP. And so what is important to me, and what I find is the most important part of this conversation, is just education. When it comes to HIV and STIs in general, education is the most important thing. The more we're educated, the more we're able to have an open discussion about these topics, and the more we're able to protect ourselves. And so if the discussion about PrEP doesn't end at that particular lobby, if someone says, hey, I heard so-and-so says this about PrEP, and then that's the end of the conversation, then we're not going to get anywhere. But if we're able to say, so-and-so says this about PrEP, is that true? Or is there any other information that I need to get? And if, so that's what's important. We need to make sure that information that's getting out is also getting, rebutted. So.
Now, one of the more, I suppose, concerning figures that's out within the American data, from my understanding, is that the largest population of seroconverting men in America is within African American males. What has PrEP pickup been like within? Do you have a circle of friends that are African American?
Sure.
Yeah.
There's a couple points. I just had this conversation with some leather folk just this last weekend, and we were talking about it in depth. A couple weeks ago, I went to a PrEP summit that was hosted by the Black AIDS Institute. And so the entire day, and it was literally an entire day from about 8 a.m. to 4 p.m., was just topics specifically talking about HIV and PrEP within the Black community. So, what are the conversion rates, the seroconversion rates? What is the outreach that's being done? How can we reach more people? What are the oppositions? What are people's feelings towards PrEP and HIV in general, so on and so forth. My personal feelings is when you look at, maps of the seroconversions for PrEP, or for HIV rather, they happen a lot in the South. They're heavily concentrated in the South. And when you look at those states, and if you look at other types of maps like teen pregnancy rates and STD transmission rates, it's pretty much the same grouping of states, right? It's the same geographic area. And so if you have an entire area that is completely so far behind when it comes to sex education, that tells me that it's not necessarily a racial issue. It's just a geographic issue. And you have to look deeper than just race. You have to look at the politics in that particular region. You know, teen pregnancy rates are high in that particular region, not just among black individuals, but white, everyone, right? So in my personal opinion, what that tells me is that there is a huge, it's lacking so much. The education about sex, the education about transmission, so on and so forth. And so what that tells me is that we need to have even more funding going into that area. We need more Planned Parenthood centers, et cetera, et cetera. So that's how I look at that particular issue. Because if you look at the map of transmission rates in other parts of the country, even broken down by race, it just doesn't mesh up the same way that it does.
Okay.
In the South.
Within Australia, PrEP's expensive, right? And within America, PrEP's expensive. And you know, a Truvada costs $600 a bottle in Australia, and I've had people tell me here in America that they're paying more than that. You know, up to $1,200 for a bottle of Truvada, which makes it almost as if it was a luxury item. So is that part of the reasoning? If people in the South if there's higher rates of seroconversion, is it more to do with economics than it is to do with anything else?
Again, you know, I go back to my point on education, that education is so important because while the sticker price for Truvada can be $1,200, $1,500, whatever, that's not actually what the average person pays. You know, my copay has been anywhere as low as $15 up to $50, depending on the insurance that I've had at the time. So if you have insurance, even through Obamacare, the Affordable Care Act, which is, you know, I think in the States that allows more people access to healthcare. So even on that, when I was on the Affordable Care Act, I was only paying $30 a month for my Truvada, right? So that's something that's granted access to everyone. If you're on Medi-Cal or Medicaid, the medication is just free. Okay, so if you're on that healthcare plan, you have access to it. If you're not on, you know, the ACA, Obamacare, if you're not on Medi-Cal or Medicaid, and if you don't have insurance through your employer, you just are completely uninsured. Gilead, the manufacturer of Truvada, still provides assistance for to get access to the drug. And like we said, you know, cities like Seattle, they still provide the drug regardless of whatever your insurance situation is. So when it comes to parts of the South, you know, it could be just an issue of education, that they need to know that they actually do have access. And even going back to Gilead, they also provide a copay assistance. So even if you do have a copay, you can still get hundreds of dollars. I can't remember what the exact dollar amount is, but it's hundreds of dollars towards the copay. So if your copay is $50, you contact them and you can get it for free. So,
okay.
Yeah.
And that's getting the drug into the hands of the people who are willing and ready to go on the drug.
And that's the thing, willing and ready. You know, they need to be educated to be able to be willing and to be ready. So education is just, you know, the number one term.
And in Australia, today's an exciting day because PrEP was just FDA approved.
That's awesome.
Within Australia. So
that's great.
The next step is, can we convince the government to contribute towards the cost of the Truvada?
Right.
And there's studies happening right now to
Good.
do that. So if you had a friend who came to you and said, look, I really want to consider this and I want to get started, what advice would you recommend to them?
First, I'd say, yay, awesome. In terms of advice, I'd ask questions about what is their healthcare situation, what's their insurance situation, do they have insurance, who's their provider, if they have Kaiser, it's super easy. Like I said, Kaiser has their own dedicated staff specifically targeting PrEP. So if you're on Kaiser, it's super easy. If you have any other form of healthcare insurance, just find out, you know, what the copay is, because it's typically categorized as brand medication, so every insurance has their own classification for how much that costs. So that's the cost issue. When it comes to getting on PrEP, go to your doctor, and what I would recommend is the CDC has a fact sheet, just a PDF fact sheet that you can download, print off and take to your doctor, it's got not only information that the layman can read, but also physician-specific information. And so you can give it to them and say, read this, observe, this is what I want to take control of my own sexual health. I want to make sure that I don't get HIV. Mm-hmm. I know that this is a tool that can allow me to prevent that from happening, mm-hmm. and I would like to utilize that tool. So if they have the information, the physician has that information, then odds are should be smooth sailing. Sometimes you might have to get transferred over to an infectious disease specialist, mm-hmm. but again, you can just provide the same information to them and it should be good to go.
So family physicians here in the States are able to prescribe PrEP as well?
I'm not sure about the different classifications of physicians. I know for myself, as I said, I have Kaiser, yep. and so my primary care physician just sent me off to the PrEP department. Yep. I've seen situations where they don't need to get an infectious disease specialist involved, but sometimes they do. So I think it just depends on the doctor and what they're comfortable with.
But the other thing is that starting PrEP can be tricky, and I think that starting PrEP for anybody is the key point where you want to get it right.
Right.
And there's no harm in having an expert in your room at the same time, right?
Yeah, I think that, I've talked to a couple guys that they've been a little bit scared of talking to an infectious disease specialist just because they feel like if they have to talk to that person, then that means there's something wrong with them. Mm. But it's totally okay to talk to someone that's a specialist in something, In the kink world, would you want to, if you're going to get single-tailed, do you want to get single-tailed by someone that's an expert, a specialist, or someone that has no idea what the hell they're doing? So there are times where it's okay and it's ideal to talk to someone that's a specialist and knows what the hell they're doing. Yeah. So
go see the dude with all the books on the shelves.
Exactly. Right? They're there for a reason.
Exactly. Yeah. What a fascinating conversation. Thank you so much.
You're welcome.
If somebody wanted to contact you to talk about PrEP, if mm-hmm. you're willing,
sure.
What's the easiest way for them to contact you?
I am Pup Beacon on Facebook, also on Recon, also on FetLife, and assorted other usernames on other sites. But Facebook is typically the easiest.
Fantastic. So. Thank you very much.
You're welcome.